Hi, I'm Dr. Sridhar consultant neonatologist and pediatrician. Welcome to my channel. I hope you're enjoying watching the videos for parent education. Do subscribe, do keep your notifications on so you can be updated when the new videos are coming out, and do share it with your friends and colleagues who would benefit from these as well. So in this video, I intend to cover some important aspects on what you can do to improve your breast milk output. Most mothers want the best for their baby. They want to breastfeed as they know that the breast milk has so many advantages. So we have short-term advantages. Reduction in infection is most important factor. We have the convenience, we have the readiness of the feed, we have the bonding experience, and we have the long-term benefits. So I have discussed in previous videos on our gut microbiomes on how the delivery by cesarean versus vaginal delivery makes an impact. Cesarean delivery has a higher risk of obesity in the future and hypertension and so on. In the same way, breastfeeding versus formula feeding, breastfeeding has more friendly gut microbiota, lactobacillus, bifidobacterium and all are higher from the early stages, and long-term health is likely to be better in the breastfeeding babies. Satiety regulation is better as well in the breastfeeding babies, as a baby decides how much to take. We don't see the volume, we don't try to give how much. So all these advantages are there. Even though the mother is focused on breastfeeding, breastfeeding as a natural process is declining because our instinctive feeding practices have reduced. We don't see our relatives feeding in the family. We don't have joint families. We don't have, we had the previous generation where bottle feeding was increasing, and many of us have lost the touch with regular breastfeeding. Breastfeeding is not taught as a curriculum for the girls in the schools, for example, and antenatal classes, even though many centers are trying to do their best, it's difficult to achieve the aim. So the main thing is to start during the pregnancy itself, read more about breastfeeding, the latching, the different styles of holding the baby, so you have visualized. Antenatal classes are important, and your center may be providing them. Do join and attend them. And if you have any issues with your nipple, like inverted nipples, you can look into that in the antenatal period as well, so you are sensitized. Be prepared to do skin to skin care and start breastfeeding within the first hour of life, because this is when the hormonal environment is ideal to stimulate the breastfeeding. So those who start the breastfeeding within the first hour of life have a more successful transition. In case your baby needs admission to the NICU, for example, start expressing within 1 hour of life. The output of milk, the quickness with which it comes, the quantity that comes has been shown to be significantly better in these situations. So discuss with your team, and if your team does support that, please be ready to do that, because it's a very stressful time for you. You're going through a lot of pain, a lot of changes. It needs some commitment to do that, but it's very well worth it. So try to do that at the earliest possible. The next important point is establishing an appropriate latch. So we have 3 stages of lactogenesis. Lactogenesis 1 is the preparation of the breast for lactogenesis that happens during the late stages of pregnancy, and by the time the baby is born, the breast is ready to step into lactogenesis 2. When the colostrum starts getting produced, the volume of milk increases. This takes 2 to 3 days, sometimes 3 to 5 days, depending on how well the stimulation is happening, the other factors like the pain, the anxiety level, and so on. So very important to understand that you don't get milk flowing from day 1. So it takes 3 to 4 days. Nature has designed the babies in such a way that they have stores in their body. They can use these stores and they don't suffer brain injury or anything. If there are risk factors, when we expect the baby may not utilize the stores properly, like if the mother is diabetic, for example, or if the baby is premature or very small, we do monitor the blood sugars in these babies to make sure that they don't suffer from the initial lack of milk. And for the same reason, we also see weight loss in these babies in the first few days. We have a reasonable range of up to 10 to 12% weight loss. If the milk is not coming in and the weight loss is more than 10 to 12%, you will have to do measures to improve the milk output, as well as consider supplementing till the period you produce your own milk. So if a supplement is needed due to these factors, please be aware it's only till your milk is available. You still need to work on getting your milk supply going. The less you give these supplements, the quicker your exclusive breastfeeding will be established. So even if formula milk is needed, for example, for medical reasons, if the sugar drops, if the weight loss is excessive, or the baby has excessive jaundice when you need some supplement, this is a temporary measure. Consider it as a medicine. It will definitely improve with time. Coming on to the steps to improve the breast milk, obviously emptying the breast is a very important stimulus. Being relaxed, not being tense about the volume produced is important. Pain control is important. Activity is important. Be active, be mobile. Don't be thinking about the lack of milk, because it will inhibit your output further. Don't think on the volume, because as I said earlier, you're not expected to produce milk. Enjoy your time with your baby, relax. Skin to skin care, even when you're not breastfeeding, will feel the bonding, and the let-down reflex will start improving. So colostrum has very rich nutrients which are very important for your baby. Try to get the latch right and breastfeed, and if the latching is not good in the beginning, remember that if it's a first baby, you're learning, the baby is also learning, and you're not experienced enough to guide the baby in the right way. So there will be some conflict. Baby may learn slower than you, your milk output may come faster than the baby takes. When the milk is starting to come in, if the milk is not emptied from the breast, there is a feedback regulation where the milk which is remaining in the breast suppresses further production. So this is a natural feedback mechanism. So till the baby learns to feed, you may need to stimulate and empty the breast, so that the milk process, production process, is not hampered because the baby is a little slow to feed. This happens more often if the baby is a little small, is premature, or for any reason had breathing difficulty in the beginning, for example, and the lung is not fully normal for the baby to suck vigorously. So it's a matter of time, maybe a day or two before the baby learns to do it. So till that time, you physically stimulate. Hand expressing is guided for the first 1 to 2 days. It's a better measure because the milk hasn't started coming in. Using a pump may hurt your breast. After you start getting a little colostrum, you can start using the pump. Many mothers prefer the pump to the hand expressing, and it's more effective and probably easier if you need to keep repeating it, especially if the baby is in the NICU. If a mother is working, they can plan and buy a good electric pump even before the delivery, so that during the lactogenesis stage, using it in addition to regularly stimulating the breast and putting the baby to the breast helps. As for the timing on the breast, even though the baby friendly initiative guides us to put the baby on demand as often, there has to be a reasonable range. So 20 to 40 minutes in the first week is a reasonable range, and 2 to 3 hourly stimulation is good. But continuously keeping the baby on the breast for 1 to 2 hours is going to tire out both the mother and the baby. You're going to end up in cracked nipple, and this will worsen your milk production. So look after your nipples, make sure they're not cracking. If they start cracking, look into the latch process, discuss with your midwife, and discuss with other persons available to help you, with like your parents, for example. Don't keep feeding the wrong way, because that will worsen things. Regarding lactogogues, which are medicines to stimulate milk output, I mean, in the early stages you don't need to really go for them, because looking into the latch, looking into the stimulation, expressing milk, emptying the breast, these are more important at this stage. But after the first 5 to 7 days, if there is still not enough milk, that is the stage when you can look at fenugreek, for example. Domperidone and medications like that is only used in situations where milk output is low for a long time. You can discuss with your obstetrician. Most mothers will not need them. So remember that breastfeeding is a natural process. However, we need the support and guidance, and the hospital teams have to be geared up to support the mother, because the benefit of breast milk outweighs any difficulty that the mother goes through. And again, a quick word about the pattern of feeding. I mentioned in the first week you feed 20 to 40 minutes, and you can stimulate both breasts, so 20 minutes on each breast and every 2 to 3 hours. But once you confirm the weight gain and the baby is feeding well, the urine output is good, baby is sleeping well, you can start spacing the feeds as per your convenience, and a good feeding pattern is every 2 to 5 hours. So avoid overfeeding, avoid too frequent feeding. Baby can be set into a pattern which is reasonable. So it's still demand feeding still, but within a range of time. That's what would probably suit most parents. So you can refer to my video on how much to feed and how to feed in breastfeeding as well. I hope this video is useful, and do subscribe and share. Thank you.